It shows 6 p.m. on my clock here.
Put some pens on.
All right. Good evening, and welcome to Ysleta Independent School District's video conference special board meeting of the Board of Trustees. We invite you to share your comments with the board during the public comment portion of our meeting. Citizens input electronic sign up shows the rules for participating in the link provided in an electronic posting notice of our meeting. Legally, the board may listen but may not enter into discussion on the issue raised. This meeting of the Board of Trustees is called to order at 6 p.m. We have a quorum with Charlie Bustillos, Soltero Ramirez, Shane Haggerty, Mike Rosales, Connie Woodruff, Fred Lucero, and myself, Cruz Ochoa. Trustee Lucero, would you please lead us in the Pledge of Allegiance and moment of silence?
I will be doing it, President Ochoa.
Okay, Mr. Bustillos.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Now the Texas pledge. Honor Texas flag. I pledge allegiance to the Texas, one state, under God, one and indivisible. Now can I have a moment of silence? Thank you.
Thank you, Mr. Bustillos. Ms. Matthewson, do we have any citizens input tonight?
No, sir, we don't.
Okay. Thank you. All right, we'll jump right into our action item. Today's action item is to update and discuss discussion regarding COVID-19 and possible action on a regional plan for reopening. Is there any discussion?
Was there going to be a presentation tonight?
Yes.
Okay, I'll wait for this presentation then.
Mr. Dr. De La Torre, do you have a presentation for us?
Yes, sir. President Ochoa, members of the board, esteemed guest, we're going to walk you through a presentation that is the result of a series of meetings held between the Region 19 superintendents, the Texas Education Agency, and specifically Mike Morath, Dr. Ocarranza.
Could you please repeat it?
Dr. Ocarranza and the county health officials relative to the recent and significant spike in positive cases across the region. Sorry, I don't know why my phone is doing that. Across the region, and there was significant interest from Region 19 and from the superintendents to approach the catastrophic increase in a uniform manner as to not position one district against another district. This process started back early last week when we met with Mike Morath. At the time, Commissioner Morath gave no indication that he intended to make any additional waivers or extensions available to school districts across the state. His position was, and I think still is, that school districts cannot deny parents and students an opportunity to attend in a face-to-face environment if that is what they want to do. I believe most superintendents left the meeting disappointed and frustrated, and at that moment, various and select local officials became involved. The Honorable Georgina Perez with the State Board of Education became very involved. Congresswoman Escobar became involved, and my understanding is they started working with city officials and with the Texas Education Agency to have him reconsider and perhaps arrive at a compromise relative to the expectations from TEA. The decision resulted in the plan that I'm about to share with you, and that the board has before them to adopt this evening, and it has been agreed to by all superintendents in the region for the purpose of reentry and reintroduction relative to face-to-face, not for athletics. Athletics was never included in this discussion. So this was, at least at the time, distinct to returning students and staff to a face-to-face environment. If I can get the next slide. When this conversation was happening, we were obviously in the red. That is true today. I believe today there were 1,443 positive cases. Hospitalization rate was hovering at 40%. Positivity rate was in excess of 14%. And if we were to take a snapshot today, we would have nothing in the orange or yellow, and certainly not in the green. After meeting with the Texas Education Agency, the Texas Department of Emergency Management, city officials, elected officials, we arrived at the following table. And again, developed with everyone in mind. It really does, in many ways, focus on one data point, one indicator. That indicator happens to be hospitalization rate. So what's being presented to you for your consideration today is this table. And if you start on the left-hand side, you'll notice that it says 20% and above. That's in reference to hospitality rates. Now, what's interesting is that even at 20% and above, or what's referred to as the red zone, school systems may, that means it's permissive, but are not required to restrict access to on-campus instruction for all grade levels. So as much as it feels like a compromise, there is still a great deal of latitude at the local level. The second bullet really spells it out. On-campus instruction must still, that would be today, must still be provided for priority populations. The definition of priority populations is outlined in the blue column to the far left, far lower left, and include students with no internet access or device at home, students of families who lack effective childcare access, students of parents of essential workers, and students with special academic needs. Not special education students, but students who could be economically recessed families, special education, English learners. And so when you look at the exception, in many ways, it really hasn't limited school districts, if they consider it, from bringing back students to participate in a face-to-face environment. The orange zone would indicate that hospitalization rate is sitting at between 15 and 19.9%. Again, it increases access to students beyond the priority population. and states that daily on-campus instruction must be provided to all elementary pre-K-5 students who wish to attend on campus. School systems may, again, but are not required to restrict access to on-campus instruction at the middle and the high school level, and priority populations must be allowed within safe capacity. They've determined that safe capacity is 50% of students at any respective campus. If we drop to 10 to 14.9%, the yellow zone, again, daily on-campus instruction provided to all students who wish to attend in grade levels elementary, middle, and high. Priority populations must be allowed within safe capacity. Safe capacity now moves to 75% of students on campus identified as a priority population, and then below 10% hospitalization rate would mean 100% of students who elect to come on campus and receive face-to-face instruction must be allowed to be on campus in all grades without restriction. This is the plan that was presented. This was the plan that was considered and reviewed by all of our colleagues. And that is the plan that, at least on the surface, everyone has agreed to use when considering who should have access to face-to-face instruction and who can still be insulated from face-to-face instruction if they don't fit the priority population indicators. Now, this is very important. When moving left to right or right to left in the select zones, as things get better, and I'll use an example. If, for example, on a given day, the hospitalization rate drops to 18%, you cannot immediately move from red to orange. That decrease has to sustain for 7 days before you can move into the orange zone. So it's not enough for us to go from 20%, and I understand that today we're closer to 40%, but 20% for this purpose and 40% are really the same, because anything above 20% is considered the red zone. If for whatever reason, in the coming days or the coming weeks, the hospitalization rate drops into, as I said, 18, 17, 16, we don't move to the orange zone until that is true for 7 successive days. We don't move from the orange zone to the yellow zone, even if we move below 15%, we would have to maintain that for 7 days. And then to move into the green zone, we would have to hypothetically have spent 7 days below 10% hospitalization rate. Now, that isn't true when we move up or in your chart to the left. If we experience an increase from 19% to 20%, it doesn't require 7 days of increases. We're required to move into the next zone with 1 day. So it's very conservative. 7 before you come down to make sure that it's sustainable, 1 day to go up so that we're responsive to the hospitalization numbers. Any questions on that? Okay, next slide, please. To date, and because of the significant high numbers in the El Paso region, as you are aware, Governor Abbott, working with the Texas Education Agency, Commissioner Morath, and the Texas Department of Emergency Management, picked the Ysleta Independent School District, one of 8 school districts, the largest school district, to participate in a pilot of the Binax Now COVID-19 AG card. This was done primarily because Austin was aware of the accelerated and elevated COVID rates in the El Paso region. And we started the pilot back on October 13. We tested 178 employees, positivity rate 0.6. The following day, we tested 305, positivity rate 1.0. Of those 305 employees, 181, 5.0, a little higher. Non-employee, 0. Student, we tested student athletes on that Thursday, and we tested nearly 300. And the reason that we continue to compete is because, notwithstanding the high hospitalization rate in the community and the high positivity rate in the community, when it comes to our student athletes, they are typically hovering around the 2% positivity rate. And based on everyone tested, we're hovering around the 2%, which at least at the moment indicates that our schools and those associated with our schools, employees and other individuals, student athletes, are not super spreaders. Any question on the testing? Okay, next slide. So based on that, this is the timeline, and this timeline is shared with some slight variation across the region. In our case, we call them learning hubs. They reopen this week. And again, that is a very, very small number of students who are still receiving instruction remotely from teachers who are still in their home and not required to come to the campus, although some have come. And I believe at present we are serving approximately 1,200 students remotely with the support of substitute teachers, instructional aides, campus coaches, and administrators. On November 2nd, Learning Hubs, that's when the extension will expire. Learning Hubs may have to be available at every campus, every school in the district for those priority students. However, the hubs can continue to be staffed by substitute and aides, and the teachers don't necessarily have to come to the school. They can continue delivering online or remote instruction from their home. On the first Friday, once we have seen 7 days of hospitalization rates below 20%, teachers will be asked to return to the classroom. The following Monday, once teachers have returned to the classroom on that Friday, 30% of students, and I'm not sure we'll see 30% of students at any one of our schools across the district, can opt for face-to-face instruction and return to their school or their campus. That is the current timeline, and that is what I think most school districts have accepted and adopted. Now, keep in mind, there are some school districts who already have their teachers on campus delivering both remote learning as well as face-to-face instruction for those priority students. Next. And at this time, I know you're going to need a little time to let it marinate, but we'd be happy to answer any questions. I really can't speculate whether or not the 7-day sequence of days where the hospitalization rate falls below 20% will happen in October. I doubt it. We have a week left. November, we are only in session for 3 of the 4 weeks because of the Thanksgiving break, or in December when we are in session 2, I believe 2.5 weeks of that month. So it's true, we could very well find ourselves having teachers return in the new year. It will really depend, as it has always depended, on the data.
Mr. Haggerty, go ahead.
Just a quick question on the testing and that pilot program that we're in. Is that the 15, 20-minute
You're breaking up,
test
Mr.
where
Haggerty.
you get the results within 15 to 20 minutes?
It's not coming in, Shane.
You're freezing up.
The
I think he's asking about the rapid testing, guys.
testing that we're using, that pilot program, is that the one that we
Shane,
get
can you call Monica and relay it through your phone so we can, you're not coming in clearly.
Or
is that
maybe-
any better?
or maybe put it in the chat box.
I don't have the chat box activated, sir. I'm sorry.
Okay.
Is that any better there?
No.
Catherine, do you know what he's asking?
What I understood is he's asking about the rapid testing, and he's asking if it's the test that takes 15 minutes or less. So that's all I really heard.
Yes. And what we envision is that prior to teachers and employees returning, if in fact we're going to have that priority population of students return, that we would ask the teachers and employees at every school to come in and take the COVID-19 test that we piloted. And it does take about 15 minutes. You can almost self-administer the test, so you don't have to create an environment where people are lined up and getting and waiting to take the test. We envision in the future that if all teachers and employees get tested every Friday or every Monday once they come back from the weekend, that they could almost pick up their test on their way in, go to the privacy of their own classroom or work area, take the test, submit the results, and then report those results to their supervisor or the administrators at that school, so that we can assure all of the parents that as of Monday, every adult on that campus tested negative.
Okay. Anybody else have any questions? Mr. Ramirez?
Thank you, President Ochoa. Dr. Lajorie, first off, thank you and the team for your diligence in this and talking with your team over the last couple of weeks. I know that it's been quite intense, to say the least, and with everything that's happening. I was just watching the national news, and we're it's a super surge now. There's setting up a hospital or extra beds around town and parking lots and bringing all these medical teams in. And so I appreciate the work and the effort, and I appreciate the work and the effort by Congressman Escobar and all those other folks who have helped out and recognized the urgency. I was watching the local news earlier, and I noticed that El Paso and Socorro and Canutillo have all announced that they're canceling sports for a couple of weeks, almost like the county judge is requesting everybody to stay home for a couple of weeks. What's your thoughts on that, and what direction do you want to go with that?
I was a little surprised to read that. I assume that when we all decided we would work closely on the presentation and the indicators that I just shared with you all, that should athletics become a topic, that we be given the same latitude to participate in a conversation. We have a slight advantage in that we have the capacity to test all of our student athletes before they participate, and we've done that on a number of occasions. The other thing that I really need to find out before I can make a recommendation or have conversations with you is what are the implications? Because I can give you 2 or 3 examples right now where it would be adverse to some of your schools and some of your communities. The UIL expects the Eastwood High School cross country team to certify before this Friday. Now that the 2 large neighboring school districts that have 6A schools have canceled the cross country season, it puts in jeopardy Eastwood High School's cross country team for moving on to the state where they're heavily favored. So that's one situation. Del Valle football, Parkland High School football, Eastwood football, and Riverside High School football are all but guaranteed playoff spots. But again, if there are no opponents, I need to find out whether or not those are to be considered forfeits or whether or not there will be time for us to reconsider those games. The same can be said of volleyball. So there are some, and maybe it's the right thing to do, and maybe we should worry less about playoffs and state championships and things like that. But I'm looking at it through the lens of the student athlete, the parents, and how much work everyone has put into creating the safe environment that we've created for our student athletes that generated that 2% positivity rate. And that was based on data and science. And so I wish we could have had the opportunity to sit with them because I think it can be adverse to any number of our communities and any number of our fall athletic programs, both team programs and individual programs. And if we move in that direction, it will also abruptly stop the winter sports season. And now you're also talking about men's and women's basketball, soccer programs, wrestling, etc. So it's not a decision that I take lightly. I understand that it appears things are very, very catastrophic around us relative to the COVID-19. But I really haven't had a chance to sit with you all, excuse me, principals and coaches. And then the other piece of that is if the other teams, if Coronado doesn't play us and Clint doesn't compete against Riverside, they don't have anyone to compete against. And I want the UIL to tell me whether or not that, for all intents and purposes, disqualifies our student athletes from going to the next level. I know we have a game this week between Del Valle and Parkland High School. It's a big game. We can certainly test both teams and they can compete, and we can do that for all of the teams that belong to the Ysleta Independent School District. But it appears that the neighboring districts are not comfortable competing, at least for the next 2 weeks. Football season was to end a week after November 8th or around November 15th. That won't give us enough time to make up 2 weeks of contests. So I don't have a good answer for you other than I'm just trying to think it through. And I know that it's one of those where if we don't, there may be sentiment out in the community that we are not taking it serious, that we are indelicate, that we're not putting safety of student athletes first. And if we do, then the other side of that argument will certainly surface, and that is the parents and the community that really support their programs and who have watched their student athletes practice very hard every day and feel like they may have had this taken out from under them. So I'd be more interested in hearing your thoughts, your initial thoughts when you read that and saw that.
Well, Dr. Latoria, and I appreciate your candid comments, and I don't want to browbeat you on this. You know how I feel about it. But you're correct. You know, what's going on right now in our community is catastrophic, and people are dying, and people are severely sick. And it just escapes me right now that we would want to continue. Now, I will tell you, the county judge has asked us to stay home for a couple of weeks. I think that's probably a good decision. And so my comment would be, my recommendation to you as a part of the consideration, and by the way, we can have another meeting later this week once you've had a chance to visit with the UIL. And I think that's probably a fair thing, is to balance, you know, what we know and what we don't know. Because of these other districts, if they have decided to not not play, if that's true, because I don't know other than what I see in the news, you know, what's the impact if at all? And so my comment would be, have a discussion with UIL, have a discussion with those folks you need to talk to. But the other reality is that we can sit here and talk, we can meet on Wednesday or Thursday and discuss this again. That's not a big deal. I think that we need to take a timeout for 2 weeks. I think that if we do that and things improve, like on your chart that you presented, or that the Region 19 presented, that it would not delay the possibility of other fall sports or winter sports occurring. I'm not trying to take that away from anybody, okay? I want to see basketball occur. I want to see wrestling occur. I want to see those sports happen. But this time is different, folks, okay? This time is different. The science, and I understand what you presented, Dr. Latoria, but those numbers were from 11 days ago. In 11 days, this community has gone from, we've got an issue, to we have a major health emergency going, not only here, but across in 42 other states. And so I would ask that if you're sincere about that, then let's get together on Wednesday evening and let's talk about what UIL has advised you, what are the outcomes, and let's be specific. Let's talk about what the impact is to each school. And so that each trustee can be responsible, be accountable for it, you know? I understand that, but at this point, in my mind, it's not only about our students. Yes, I know they have a very low infection rate, but it's also about those coaches that are out there, who I know those coaches want to compete, but they may not be super spreaders, but they are spreaders. They're not immune from this. And so that's my thought on it. And that's what I would like to see you do going forward. And then also to find out what the heck these other districts are doing. You know, I was real surprised by all of that. And so, and you know, we talked to the other trustees from the other districts, and I had not heard that from them. So again, that's my thought. Let's take the next 2 weeks off. Let's catch our breath. Let's keep everybody healthy, whatever that means. And then, like I said, in a couple of days, you come back and talk to us about what UIL wants, or at least a BC, letting us know what goes on. But I think the hard decision is for you to do that. Or if you want, then let the trustees make or not make that decision, and let us take responsibility for that. And that's our job too, especially in times like this. Thank you very much, President Ochoa.
Thank you, Mr. Ramirez. Ms. Lucero, you had some, Catherine had raised her hand.
I just want to comment. I mean, I feel really conflicted with I'm sorry, guys. I feel really conflicted with this because I obviously I have COVID and my daughter has COVID and COVID is everywhere. But I also am cognizant, you know, I did reach out to my coach at Del Valle, and I understand that some of our kids have literally nobody. They turn to the coaches. They turn to the coaches as an extended part of the family, and they watch them. And they're not daycare providers. They're not any of that. But I appreciate that will we live up to what we say at all of our communities? I know that Valle is one family, one destiny, but I appreciate and honor that at our school district, we take our kids and our students and they become part of our family. And in speaking to my coach, he helps with these kids during the day. Some of our kids do go and attend the hubs, and right after the hubs they're on them even virtually, and then after that they're at practice for those few hours, so they know during the time they're at the hubs, during the time they're at practice, they're taken care of. They're not on the streets, they're not out there gathering together, they're taken care of, and that's an important consideration as we're going through this. I don't know if we're not competing, if there's still a possibility for them to be able to continue doing that, knowing they've been tested and they continue to be safe, because ultimately the goal is to keep our kids safe. And if we are able to do that through our coaches' help, we're keeping our kids safe. I think that's an important consideration too. I don't want to add to the medical crisis that is happening in our city. We have doctors that are getting sick. I had a physician reach out to me for us to be able to, pleading with us as a district to please help in any way we can for the next couple of weeks. And so there's just a lot to balance and a lot to consider, guys. And I don't take any of these decisions lightly. Ultimately, our health is at stake, our community is at stake, but I do want to make sure that our kids are taken care of at the same time. Thank you.
Thank you, Ms. Lucero. Mr. Bustillos, and then Mr. Hagerty. Okay. Go ahead, Mr. Bustillos.
There you go. I guess, with this whole thing coming up, I've talked to several trustees about this, and I know and I respect, the viewpoints of Mr. Ramirez and obviously Catherine and everybody's here. I go back and look at what I went through with my daughter in June when I told her that her softball season was over. I had to tell her that her prom was over. Had to tell her, most importantly, her graduation was over. And one of the hardest things I've had to do as a father to do that. With that said, I look at our kids throughout YSD, and I've been to pretty much a lot of these games, and I see these kids competing, and I see that's something that's all they have right now. Some little bit of normalcy, something that they can fall back on that's going to be theirs, and they still do their virtual classes, but they have that. And I wish we could give that to all our seniors in our district, not only through our district, but through the city. I wish we could give that to all our kids in this city to be able to experience what we all went through in our time being seniors. And that's what gets me is the seniors. Now, going over the numbers and that we had, 2% positivity on the testing for ours, but we also have from 18 to 64, 77% of our community that's where the infection is. Our 5 to 17-year-olds are at 9%. So we know that the transmission rate is between the 18 and 64-year-olds is what's causing this problem and this spike. And I believe that I know we can talking to the coaches, several coaches, and I talk to these coaches, they really want to play. And they really want to be part of it and continue to help their kids get better and give them some reason to continue the school. I also saw something in the news where failure rate was high. Our failure rates were high in every school district from here to New Mexico, and a lot of our athletics are helping those kids pass. So it is helping our kids in so many ways. But I'm also conflicted with keeping our kids safe. And I think that Dr. De La Torre needs to go back and talk to UIL and see what we come up with. And I want to make sure that our kids are safe both on the field. If something happens to them, we have the doctors and somebody there for them to take care of them if somebody gets hurt. And also if obviously we get if we have some transmissions of the virus. So I think if we can come back and put this on Dr. De La Torre and see what UIL says. I think that'd be great for us. Like Mr. Ramirez said, we come back and look at this on Wednesday for our kids to see what happens. And lastly, I just, really, it hurts. It hurts to see our kids missing out on these things. And I just want to make sure that they get every opportunity and every advantage to do that. Just one more thing on this. 4A, just so you know, 4A plays, which would be our team, Riverside, would be playing against Clint for a district championship. First time in 15 years, okay? If it doesn't happen, we have a bye week. The rest of the teams have a bye week, so they're not gonna, most of the teams aren't gonna play this week, with the exception of Del Valle and Parkland. The rest of the teams will not play, and they have a bye week. So there is some room in there that we can probably play with Dr. De La Torre. I don't know. You can look at it. So those are my comments, and I thank you so much for everybody here for hearing me out. So thank you.
Okay, thank you, Mr. Haggerty, and then Mr. Rosales.
Hopefully this sounds better. But part of my original question was answered. Thank you for that. The other part of my question was, how accurate are those 15-minute tests? Have they been verified? They're pretty?
The reliability is 97% reliable or accurate.
Thank you.
Okay, Mr. Rosales.
Relative to a meeting, in order to meet the 72-hour requirement, the earliest we could meet would be Friday. The challenge, of course, is that the games are on Friday. And so we're going to probably be pressured into, and by the way, it isn't necessarily a board decision. I think what's different about us and maybe some other school districts is I've always thought it very important to communicate regularly with the board, but that isn't true in other school districts. I'm aware of situations where their board members learned of that decision the same way you did, by reading it in the paper. And it is, at least at present, it is an administrative decision, which means that I have some latitude to meet with y'all individually or in smaller groups over the next 2 days once I find out the information. But it's going to be one of those where I'm going to be damned if I do, damned if I don't. And going in, that's really what leadership is about. It's easy to make leadership decisions when everybody is on board and everybody is in support. These are the times where you really have to try and collect as much information as you can, talk to coaches, talk to the UIL. As I understand it, relative to the cross-country team, both EPISD and Socorro ISD would have to concede victories in order for Eastwood to meet the deadline on Saturday and be the representative from this area. We'll start working on that. I don't know whether football and other sports are the same, but we're gonna spend a lot of time tomorrow, a lot of our time tomorrow, trying to get as many answers for you as possible, getting those answers to you in writing, and then making ourselves available to each and every one of you before we make any kind of announcement. And I know it. I sometimes hear that don't let them be first, and I'm not about being first. I'm about being right. and being, as we always have been, very thoughtful and deliberate with the decisions that we make. And it may be the right decision to suspend sports for 2 weeks. I just don't like the idea that there would be some kind of an adverse consequence to the student athletes who are innocent in all of this.
Thank you. Mr. Rosales?
Enough has been said. My comments are very simple. After listening to all of you, the sensitivity of this board is unbelievable, but that's why we're here. We're here to make sure that we keep our end of the bargain, meaning the student education, the student well-being, and then on the other side of the coin is a very major part of our student lives is the sports. But one of the things that I sit back and I just it's so frustrating to hear from the TEA, and yet UIL comes in with a different angle, and we're trying to get answers, having a sensitivity to those athletes. And again, I cannot express my sentiments to the coaches, the athletes, the trainers, everybody that puts a lot of effort into their sport. But I will tell you this, that my biggest responsibility is to make sure that we don't lose anyone. You know, you can miss a prom. I missed my graduation in college. I had the good fortune of serving this country. I didn't get to go to graduation, but those things happen. And this is part of what our responsibility calls for. We're going to have to make decisions just like Dr. La Torre made or mentioned. Sometimes we have to make these very difficult decisions. And having said that, I do take into account the sentiments, the feelings, the emotions of one part, which is the athletic part. But on the other hand, we're dealing with a monster. We're dealing with death. We're not dealing with something that's going to go away tomorrow. We sit in the biggest port of entry in the world. We cannot. It's very, very hard to close this bridge because of the fact that the interaction of people. And in my estimation, it's another corridor that has flamed this thing, and it continues to flame it. The other part, and I say this to the public, isn't it enough time to follow the rules? We can curtail a lot by maintaining the mask, the social distancing, and on and on and on, all that we've been told. But if you go out, and it's amazing, I was at a restaurant, In and Out, every person that was there did not have a mask. Again, when is El Paso going to take this monster serious? When is it time? 1,400 people in one day is a lot of people. And I say this to all the people that I represent in Eastwood. I care about the students. I care about the student athletes, but we've got to be very careful. And I would want to get some feedback from Dr. La Torre as soon as it is possible, that we can get some more and additional and important information. And that, I think that's about it. Thank you, guys. And I appreciate all your work, all of you. This is a very caring board. We care about people, and that's where we're at. Thank you.
Thank you, Mr. Rosales. Ms. Woodruff?
I actually have just a question. I wanted to know, how often are we testing our athletes, and how often are we doing that?
In the last couple of weeks since we've had the tests available, we have been regularly testing athletes, and most of the time it's because, as you can imagine, their parents are getting more and more worried about their participation in sports. So whenever a coach approaches myself or Mrs. Leeper or anyone at central office and says we'd like to have them tested, we've made arrangements to test them. Like I said, we sit in a unique situation where theoretically I could test all of the Parkland High School football team and the coach and the Del Valle High School football team and their coaches, their personnel on Friday morning before they play. And I'd be willing to do that for opposing teams and continue and restrict spectators to 0. But I'm getting the impression from some of my colleagues that isn't enough. But we have the capacity to test every one of our teams before they participate, and we have the capacity to test the opposing team before we participate. But because at least 3 of them, and I suspect Clint is probably knowing Dr. Martinez, and I respect Dr. Martinez. It's very likely that we may have Clint step back for a couple of weeks. And then in effect, the only teams that we would have available to compete against are our own. And that works for 5A, it doesn't work for 4A, and it doesn't work for 6A.
So my comment would be that I think that we pretty much need to have some sort of rule. I'm not going to say policy, but some sort of rule in place that that at the very least, if we do continue on with our sports, that both teams are tested, like you said, Friday morning before the games and things. At least, at the very least, I think that needs to be something that happens. So that's just my comment on that.
Okay, thank you, Ms. Woodruff. Anybody else? Mr. Ramirez?
I'd just like to echo what Ms. Woodruff said. Is, not only would have to the testing, and I appreciate that Dr. Latorre would be willing to test the opposing districts teams, but also too it creates an interesting dilemma. What happens if even just one kid is positive on any team? What impact does that have on whether the game is played or not? So not only as Ms. Woodruff said, we'd have to have some policy, but also some guidance about how we do things. And I know we have all types of contact procedures in place, but I would be curious on that as well too.
Yeah, and we have canceled games. Matter of fact, we canceled Bel Air just this last week when their coach tested positive. So in some cases, the game can't happen. And on the other end of it, if, on Friday afternoon, you can take a position that says all players and coaches and sideline personnel tested earlier today, and based on a test that has a 97% reliability rate, we feel comfortable sort of moving forward I guess we've created this bubble for at least one day. That helps us. I don't know that even if we offered that some of the neighboring districts are comfortable competing in athletics right now. And I'm going to call superintendents and first, very diplomatically express my disappointment in not having had a conversation about this, a region-wide conversation, because athletics tie us all together. But then second of all, what is it that you hope to see happen on November 8th that would give you a level of comfort to come back and start competing again? And if the answer is we're going to get our tests by November 8th, then I would be open to, if TEA and TDEM allow it, lending them the number of tests that they need to assure that their student athletes are safe, and they can reimburse us sometime down the road for those tests. But yeah, we have a lot of unanswered questions, and Mike Williams and Martin Segovia, I'm going to ask them that tomorrow. They have a lot of answers for us by school, by sport, and share that with all of you. And then I've got volleyball tomorrow night. So, depending on who they're playing, they may or may not have a game. And then, of course, I've got the lower levels that start as early as Thursday before the varsity level plays Friday. So I've got to get some real momentum and some traction going tomorrow, and you'll probably be hearing from me tomorrow in terms of how things are going. And then if we have to make the hard call, we'll make the hard call and take a step back.
Thank you. Anybody else have any added comments? After hearing everybody present their comments and what they think, I think we're all in agreement that this is a difficult situation for all of us, for our student athletes, for our teachers. We've been talking about our student athletes, but we also have everybody from fine arts who hasn't been able to participate. All the seniors that have in band, cheerleaders, all our performers there at half times, they're all missing out on this. And it has been detrimental to them. We understand that. But we also understand the severity of how it's going within our city. As Mr. Ramirez pointed out, it's not getting any better. It's not getting any better at this time. And then with Thanksgiving coming around and Christmas coming around, it's just hard to see that this will alleviate at any time soon. But we just have to make the right decisions to the best of our knowledge. Like I talked to Mr. Ramirez, I mean, history will be the judge of how well we made our decisions, because afterwards, everybody can see the big picture. But right now, all we see is that we have a lot of COVID cases, but we also understand the sensitivity of what our athletes are going through, our fine arts is going through, everybody's suffering in one way or the other. And like Ms. Lucero and myself, we have had personal situations where this COVID has struck our families, or like Ms. Lucero herself. And I know that this is a deadly virus. I mean, it's just unbelievable. So I did have one question for you, Dr. De La Torre. Going back to the 7 days, if the hospitalization goes below 20, and we have 6 days that are below the 20, and then on the 7th day it goes back up, do we start the clock again?
Yes.
Yes. So, and then my next question would be, okay, say the 7th day that we had low rates below 20, it ended on a Thursday or Friday of that week. Do we wait until on a Friday? Do we wait until the next Friday to start school to get prepared?
Probably, yes. In order to get the teachers in and tested before the students arrive on Monday, we would likely need the front end of the week to test the adults before welcoming back the students on Monday.
So if let's say our hospitalization on Wednesday, it met the 7-day criteria, would teachers be back by that Friday, the same week, or are we going to have an allotment of time to get prepared?
No, the teachers would be asked to come back and take a test Thursday and Friday in preparation for opening the school on Monday.
Monday, okay. So everybody's going to get tested because we have that rapid testing that has been provided by the state government. Okay, so in a way, that's a good measure as far as who's coming back. And yeah, that's all I have. Anybody else have
Our plan says that we will not put teachers back in the classroom with any less than 48-hour notice. So it's actually a temporary cushion.
Okay, that's good to know.
All right, I will be in touch with you over the next couple of days individually, just to kind of give you an update. More than likely, we will have a very detailed board communique. So I know you're all very busy, but if you see it pop up on your email server, and you can take a few minutes to kind of read through it. Please do so. And again, we're almost in a reactive situation because we did have volleyball games across the district scheduled tomorrow, and some districts have already decided that they won't be showing up. So I'll have an update on that as well.
Thank you. I appreciate that. I think we all will be waiting for that update. It really will help us in understanding what the situation is.
And it's going to make it a little tricky tomorrow because if you haven't heard, there's supposed to be a tremendous storm coming in
Oh, yeah.
tomorrow. And so I suspect a lot of people will work from home tomorrow, but we'll get out and get in contact with them and then make you aware of what's going on.
Okay. Thank you, Dr. De La Torre.
Thank you all. I appreciate you.
Thank you, everybody. Thank you,
Yeah.
Dr. De La Torre.
You're very welcome.
If there's no further discussion, we have a motion, and I'd like to make the motion, please.
Hold on,
Ooh.
Miss Austin.
No, I was just wondering if you were going to do the motion. Thank you. I'm sorry.
Yes. Yes, I am. Okay. If there's no further discussion, I'd like to make the motion.
So
Mr.
moved.
President,
Okay.
this is Connie Woodruff. I move as requested by the superintendent in consultation with Region 19, the local health authority, and the Texas Education Agency approve the proposed regional plan using the trauma service area hospitalization rate as the indicator for determining when to limit access to on-campus instruction.
Okay, Connie.
Second.
Okay, second, but I have a revised motion here that
So
was
sorry.
given to me. But is it okay, Monica, to read this, or Ms. Austin, or do we accept that one? Only has this one word difference in it.
Yeah, I think it's okay.
Okay. All right, so it's been seconded by Mr. Ramirez, motion made by Ms. Woodruff. Okay, Trustee
Yes.
Bustillos, how do you vote? Trustee Ramirez, how do you vote?
Yes.
Trustee Rosales, how do you vote? Trustee Rosales, how do you vote? I think he said yes.
Yeah.
Yeah. Trustee Woodruff, how do you vote?
Yes,
Trustee Lucero, how do you vote?
Yes.
Trustee Haggerty, how do you vote?
Yes.
And I, Trustee Ochoa, vote yes. The results are 7 in favor. Thank you all so much. If no other business to discuss, do we have a motion to adjourn?
so moved.
Okay, adjourn. Thank you all.
Thank you.